Madam Deputy Speaker. The most difficult times often demonstrate the power of people coming together. The creation of the Compassionate Community Hub in Bath had an incredible response. Thousands of Bathonians signed up to help vulnerable people in our community. And I would like to recognise the fantastic work of 3SG, Virgincare and Baines Council in getting this up and running. And I give my heartfelt thanks to all of those who have given their time to help. Some residents have felt isolated and alone. Some face financial worries or housing insecurity. Compared to the same time last year, Bath Citizens Advice has reported a 34% increase in employment issues and a 200% increase in issues around utilities and communication. Even something as simple as the closure of our local skate park due to lockdown can mean a coping mechanism is no longer available. All of these things can contribute to worsening mental health. Analysis suggests that mental health has worsened substantially as a result of the pandemic. 43% of psychiatrists have seen an increase in emergency and urgent cases. The Royal College of Psychiatrists say there will be a tsunami of referrals. The Centre for Medical Health forecasts 500,000 more people will experience mental health difficulty this year. If there is a second wave, the effects could be even greater. And this is not a new problem. There has been a mental health crisis in the UK long before this pandemic, and it will become even clearer that the system is not working. The government must take mental health seriously. Unless plans are put in place to meet this extra demand, mental health services will not be able to cope. I urge the government to work closely with the voluntary sector, who are calling for the creation of a national mental health renewal plan. We can learn from the expertise of these organisations. They have been invaluable throughout the pandemic. Progress towards parity of esteem for mental health will need funding. Of course, that means the NHS, but social care, local authorities, welfare and community services will all need proper funding too. Mental health cannot be viewed in isolation. It needs to be placed at the heart of society, in schools, workplaces, and in our communities. In Bath, local organisations have stopped many of our residents falling through the gaps. Bath Mind have had contact with over 500 people across Baines who were not known to them prior to the lockdown. DHI have worked with over 2,500 people on GP shielding lists. Many were not previously aware how to access help. Without these organisations ensuring prevention and early intervention, the cost to the statutory sector would be enormous. Certain groups have disproportionately felt the impact of COVID-19 on their mental health. A study has found that levels of anxiety and depression remained high among low-income households, people with diagnosed mental health already, and young people, even as restrictions ease. Research from the Royal Society for Public Health suggests that young people's mental health has suffered most as a result of the pandemic. We know that people under 25 are much more likely to be working in sectors that have been closed. DHI Bath have also shared concerns about the increase in family conflict and being witness of parental domestic violence and exploitation through county lines. A national young person's lockdown exit strategy is needed as part of lockdown easing. We cannot allow young people to be further disadvantaged and must stop this crisis to develop into a pandemic of mental health. Mental health issues do not discriminate. Local authorities must have the resources to support our communities. Warm words are not enough, and I urge the government to act now. And Madam Deputy Speaker, since I've got a little bit of time left, I just want to say we have heard many people in the House speak very powerfully about in support of their communities, and there couldn't be a bigger fan of my city of Bath than I myself. And I'm sure I echo the sentiments of a lot of my colleagues across the House that I will do my utmost to make sure that Bath and my constituents will get through this crisis as safely as possible, get back on their feet and thrive once again.